Hello, my name is Rachel Kelly, and I'm presenting my SimpleMinds assignment, which this week's topic was epidural use in labor. So, for an epidural, that is a combination of an anesthesia and an opioid. Can be used for surgical purposes outside of labor, but for our purposes, it is being administered for labor. Sorry about that, that was the cat. So indications, it's a local or regional anesthesia for surgery. Like I said, it can be used for both vaginal and cesarean births. And the incidence of using this drug, approximately 60% of the women in America the United States will receive an epidural for pain management during labor. This number fluctuates outside of the United States. 80% of women in France are likely to use an epidural, and this number has been high since 1997. We also have in the UK 35% and rising. In Canada, it's roughly 58%. And you'll notice in Asia, the usage of epidurals in labor is much smaller. In Japan, it is currently approximated to be 5.2% of the population. So a potential nursing diagnosis and most popular diagnosis for epidural use in labor is acute pain related to progressive labor, and this could be as evidenced by a patient report out of 10 out of 10 pain. It could also be evidenced by an increased blood pressure, and another possible nursing diagnosis would be risk for injury related to the post-administering the epidural. So mechanisms of the action, this anesthetic will inhibit the initiation and conduction of sensory nerve impulses. This thus alters pain. The therapeutic effect, decreased pain and induction of anesthesia. So low doses, more minimal effects on the sensory motor function. Higher doses, you could result in a complete motor blockade. The dosages for this drug, 10 to 20 milliliters of 0.2% solution initially, continuous effusion of 6 to 14 milliliters per hour. Once again, 0.2% solution. Incremental injection is 10 to 15 milliliters per hour. And administration, this is injected into the space outside of the dura mater. So it's a spinal injection, and it's between L3 and L4, lumbar 3 and lumbar 4, intermittent or continuous through catheter. And this is given during active labor or for nullipartum, and that'll be at 5 centimeters, desired to prevent the slowing of labor. Prior to administering this drug, this will also be a part of an assessment, is to obtain 20 to 30 minutes of EFM strip before the induction of a spinal anesthesia. Side effects for an epidural, you're going to be looking out for maternal hypotension. This could also cause bradycardia or tachycardia. This could cause decreased maternal respiration rate. Maternal bladder could distend. This is a factor. This is due to the opioid component of the epidural, which opioids can cause urinary retention. And a major side effect to be observing for is any indication of seizures in the mother. A risk for the actual puncture site, you could have leakage of CSF fluid, and it could cause a spinal headache. So you're going to be checking the site of the injection as well. Contraindications for administering an epidural. You have spinal surgeries, you have abnormalities to the spine. This could be scoliosis or something similar to that. You have coagulation defects, infections, hypovolemia, and not most importantly, but very important, patient refusal. Nursing assessment. So when administering this drug, you're going to be assessing the sensation during the monitor for sensation during and after the procedure, after labor. So they will likely lose feeling from the waist down, and this will progressively return after delivery. You're going to continue to monitor that until full functioning is returned. You're also going to be assessing for orthostatic hypotension. This epidurals can cause orthostatic hypotension. You're going to assess for system toxicity. This has multiple different symptoms, and if you observe any of these, you're going to report them to an anesthesiologist. You're also going to be assessing for unwanted motor and sensory deficits. So as I said before, the low doses of anesthetics are added to the opioids for pain management, not to produce anesthesia. So that is that is an adverse outcome. If that occurs, you're going to be observing for that. Patients should be able to ambulate after receiving an epidural. How they work is your patient's first going to have their pain alleviated, and then temperature, touch, proprioception, and skeletal muscle tone will be affected. Psychosocial considerations for this diagnosis. This is an option, not a requirement for labor. Getting an epidural is a choice of the patient. You should not be pressuring your patient or judging your patient. You need to let them make this choice on their own. Giving birth is sometimes a very spiritual moment for the mother, and you do not want to take away from her moment or her babies. So nursing interventions for an epidural, you're going to do frequent vital sign checks, and this is maternal and fetal heart rate and the whole regular vital signs. You're going to, for the mother, you're going to monitor the patient for adverse effects related to the analgesia. You're going to decrease labor pain. You're going to also put your patient on fall precautions. So before they ambulate, they're going to reach out to you and let you know so you can assist them to the bathroom. I also recommend keeping the bed at a low height, the appropriate amount of side rails up as per protocol of wherever you're working, and perhaps even a fall alarm in case there is a change of mental status so that you keep your patient safe. You're going to make them familiar with the call button as well. So the desired nursing outcome is a decrease in labor pain without unwanted sensory and motor deficits. As you can see, the patient education required for this drug is also going to be related to keeping your patient safe and their baby. So orthostatic hypotension is a common adverse effect, and so are motor deficits. You're going to want, as a part of fall precautions, they're going to request assistance during ambulation. So this was a brief overview of epidural use in labor, and I hope this was informational and good enough. Well, thank you very much.